welcome to Hudson Health. My name is Dr. Angel Lazo, and I'm with RWJ Barnabas Health at Exchange Place. And I'm here with my co-host.
Welcome, everyone. I'm Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, which is a member of RWJ Barnabas Health.
And today we have actually a very exciting segment, because today we actually have a special guest, Dr. Kimberly Skelding, and she's the Chief of Cardiology at Jersey City Medical Center.
Dr. Skelding is brilliant. She's going to tell us today about everything from symptoms of heart health to when to see a cardiologist to best diet. We're going to ask her about sleep, right? Which is very important, which you get more of, and it's heart disease genetic. But more importantly, I want to talk to her about how heart disease affects women, right? Because it's different.
Yes, absolutely. Especially with the prevalence of heart disease in our community and globally. The woman's perspective is actually very unique, because that's a topic that's actually very common. You know, are the symptoms for heart disease the same in women and men, and so on and so forth. So we're going to be discussing this, and especially the program that we have at Jersey City Medical Center at our hub in Hoboken in reference to cardiology, which is a really big deal. So let's bring in Dr. Kim Skelding, and let's start interviewing her.
Absolutely.
You ready?
We'll be right back.
We'll be right back.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County, because your heart doesn't beat just for you. So get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Panapinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panapintodevelopment.com. Panapinto Properties, building Jersey City for everyone.
Hi, everyone, and welcome back to Hudson Health. My name is Dr. Angel Lazo, and I'm with RWJ Barnabas Health at Exchange Place, and I'm here with my co-host.
Hi, I'm Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, which is part of RWJ Barnabas Health. Excited to be back.
So today we're going to have a special guest, Dr. Kimberly Skelding. She's the Chief of Cardiology actually at Jersey City Medical Center.
Cheers.
Now, we have a lot of advances in technology, you know, and she's probably going to be talking about some of the structural heart disease program that they have at Jersey City Medical Center. But I think she's going to have a very unique perspective, not just as a cardiologist, but also as a woman cardiologist, to discuss women's heart health, which is very important as well.
Right, and I think as in many disease processes, women's health has been overlooked, and it's really different. The presentation is different. As we know, just sometimes women don't seek care early, or it's minimized. So I'm really excited to hear that. And, you know, I'm an emergency physician, so I see all kinds of presentation. But we do know women present differently. They may not have the typical crushing chest pain that men have, or they might be taking care of everybody else in their family first before seeking care.
No, very true. I mean, I see that actually even in my practice, you know, where the women are constantly taking care of the husbands, but, you know, they miss their appointments. Even though, to be quite honest with you, they're actually better patients for me, because they actually listen, you know, and they actually do pay attention. So we are going to be discussing a lot of the preventive health that, you know, not just men can do, but also women can do as well. Right,
and we would like to know from Dr. Skelding what kind of special tests do women with chest pain have. But I like how you talked about preventative health, because this is not just do we have the infrastructure for full structural heart interventions, heart disease, but we also want to prevent these interventions. So we want to talk about diet, right? That's a big thing that we're frankly catching up to in medicine.
Absolutely. And that's one of the beauties, actually, of this system over here at Robert Wood Johnson Barnabas Health at the Medical Center. You know, the way they have their heart program structured, especially, it encompasses just about everything. In fact, the nearest to me is the hub actually in Hoboken, which offers a lot of these special testing and so on and so forth. Again, it's very important, especially from a preventive point of view, you know, to get ahead of the game when it comes to heart disease. And Dr. Skelding is actually going to go over a lot of the risk factors that are associated with heart health, you know, that pertain not just to men, but also to women as well.
So you and I know, having gone through medical school and years of residency and sleep deprivation, how important it is to sleep, and all these things that we sort of took for granted that come into the forefront. The research is finally showing us how sleep is important, diet, exercise. So we're going to ask her for some of those things and some of those numbers, but also simple things like, when do you see a cardiologist?
Yeah, and that's a great point, because again, when it comes to heart disease, you may not always necessarily have a symptom until it's actually too late. And again, that's the whole focus, especially, for example, what we do in primary care family practices to do preventive services. And it's specifically with that intent to be able to get ahead of the disease before it actually becomes a problem.
Absolutely, before they come and see me in the emergency department.
Or they see Dr. Skelding in the cath lab. So yeah, absolutely,
agreed.
we want to prevent that. So what are some of the other things you think Dr. Skelding is going to inform us is actually new? Because there's a lot of new technology out there in the cardiology realm.
Yeah, I'm excited to hear about the structural heart technology, and the technology has grown in leaps and bounds. And not just technology for its own sake, what it's really done is the age range in which we can intervene for people, everything from TAVRs. I'd like to hear more. We had one of our cardiologists a couple of weeks ago, so I just want to expand more on where the technology is taking us.
Yeah, last time we actually had spoken to Dr. Michael Benz, who's an integral part of the structural heart program. Dr. Benz has actually been in this community for a very long time. And our WJ Barnabas Health is really devoted actually to, especially the heart health of the Hudson County residents and all of New Jersey. Dr. Skelding actually is not just an interventional cardiologist, but she also specializes actually in TAVRs, which is very unique. It's a non-invasive, even though it's invasive, but it's less invasive than, let's say, open heart surgery, for example. So they're dealing not just with valvular heart disease as far as the aortic valve, but also mitral valve clipping. I mean, there's a lot of new technology that the residents of Hudson County are actually very lucky to have actually a system like Robert Wood Johnson Barnabas Health.
I think not only are we fortunate to have a system like ours, but to have somebody of his skill level being our chief of cardiology to bring all this expertise. It's a thrill for us, especially here as we talk about Heart Month and women's heart health.
No, the talent that RWJ Barnabas Health is actually able to attract is incredible, and Dr. Skelding is actually a perfect example of that. Just building to the structure of what RWJ Barnabas Health has actually done in this community. So I think we should talk to her. I think we should probably bring her in. So how about we bring her in and we get these questions out of the way?
Okay.
Sounds good?
We'll be right back.
We'll be right back.
Jersey City Medical Center has a passion for heart health. We're Hudson County's only full-service heart hospital with innovative technologies and premier cardiovascular physicians, a partnership with Rutgers Health, the latest technology and medical advancements, and nationally renowned care for every heart in every community. Whoever your heart beats for, our hearts beat for you. Jersey City Medical Center.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Welcome back. My name is Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a member of RWJ Barnabas Health. I'm here with my co-host.
Hi, my name is Dr. Angel Lazo, and I'm with RWJ Barnabas Health at Exchange Place.
And we have the spectacular honor of having the Chief of Cardiology at Jersey City Medical Center, Dr. Kim Skelding, with us today. Dr. Skelding, welcome. Can you tell us about yourself?
Welcome.
Thank you for having me. So I have been here for just a little bit, but it has been a wonderful beginning to my time. I am a structural and interventional cardiologist, which means that I do procedures that previously had been done by surgery alone, and we do it through usually a groin, through a blood vessel in the leg. And also I have had the pleasure of helping to move along the women's heart programs at many centers across the country. And so that's been also a very fulfilling part of my career.
So welcome to New Jersey. It's great to have you.
Thanks.
Absolutely. So elaborate a little bit more about the health program that you have, especially for women. So let's talk a little bit straight into the women's health as far as heart disease is concerned.
Well, for the longest time, clinical trials and data we had was all found in white men. So we had very little data in women, very little data in people of color. And we learned over the years that women are just not little men. Women actually are different genetically, and they need to be treated differently. And so we've learned a lot over the years. Unfortunately, it should have happened 20 years ago, but we're getting there. We think that we should treat women a little bit differently, and there are definitely different risk factors and different testing for women. So one of the things that we are bringing here to Jersey City, which I think is really important, is looking at not just the big blood vessels of the heart, but the tiny little blood vessels of the heart. And so we know that women, percentage-wise, have more heart attacks, and then we can't find a blockage. And so we are now going to be able to do some exquisite testing to identify, is it their heart? Is it something that we need to do something differently about? And not just say, well, gee, we haven't found anything, it's not your heart today.
Very interesting.
That is very interesting, because some of us that trained before this technology was available could tell how many patients would have, and there would be no blockage of the big vessels, but they had chronic chest pain.
Right.
But let's, this is so fascinating, but I just wanted to bring us back to, when should a woman or anybody see a cardiologist? That's a question people have for us at home.
Right. So between the ages of 20 and 40, everyone should see a cardiologist probably every 4 or 5 years and really get a very extensive risk factor profile done. At the age of 40, you should probably do that every year. And not only know what's going on in your heart, but just have an overall health physical.
Now, heart disease is typically asymptomatic, but if you're going to develop symptoms, like what would be the typical symptom, for example, that would suggest to a typical patient that maybe I'm having a heart problem, some of the heart disease type symptoms?
Right, so we know that about 75% of men and women both will have chest pain as one of their presenting symptoms. The second most common symptom, interestingly enough, is fatigue. How many of us are not tired, right? So fatigue is a big symptom, shortness of breath, nausea, sweatiness, but not everybody gets chest pain. Some people get jaw pain, some people get shoulder pain. So many people have gone to the dentist for problems with their heart.
Yeah, it's a very good point, because especially, for example, that general phrase of chest pain. I mean, I see that even with my patients, that I ask them just a direct question, to have chest pain, and they're like, no. But then they describe something to me that's considered, like, for example, an angina equivalent. Now, how would that differ, for example, for women? What are the typical presentation, some of the symptoms that, say, women may present with?
Right, women tend to have a more extensive symptomatology, and so often the chest pain gets lost in the narrative. And so as I go out into the community, meet women, talk to women, and instruct them on how to get the best care for their heart, I say, you really need to tell the story, and you really need to get to where your symptoms are. Most of the time, they're telling a story of where they were, how they felt, what they were doing at the time, but they also need to just be very delineated about their symptoms. Men tend to say, I have chest pain, and it takes me 10 minutes to get the rest of it out of them.
And it's interesting that you say this, because especially for women, I mean, with all the responsibilities that's just part of everyday life, the fatigue may just be chucked up to everything else, right?
And I think it's just very important to think about a change in status, right? And so, yes, we all get tired, but are you more tired now than you were a week ago? Is something really dramatically changed? And so if you were able to carry things up the stairs before, and all of a sudden now you're short of breath doing that, that's a change. And so really those changes are really the vital part to ask about.
Very good point, yeah.
It's a great point. Now, what risk factors should everybody know about heart disease?
Well, we know the traditional ones, blood pressure, cholesterol, those are numbers that you should have checked every year and know your numbers and try to track them. There are also other things, diet and lifestyle, sleep hygiene, stress. Those are things that can contribute. We know that for people that aren't sleeping well, they need to get at least 6 hours of restful sleep in order to not cause that to be a risk for their heart. Many people have high blood pressure, and really we find that it is a sleep disorder that's causing their high blood pressure. And so all of these things work together. And so it's a matter of just really having a good look at what you're doing on a daily basis. Diet and lifestyle, again, are very important, because prevention is the best treatment.
And what are some of the non-invasive modalities, for example, if you suspect that your patient maybe has heart disease and so on and so forth, what are some of the modalities, for example, that are offered at Jersey City Medical Center, even at our Hoboken hub for our patients?
So certainly doing a treadmill stress test to identify both the functional capacity, how much they can do, and are there changes on their EKG while they're exercising. But echocardiograms is important. That's an ultrasound where they put jelly on your chest and take pictures of your heart. Very important to look at the structure and function of your heart. Also, stress tests like nuclear stress tests where we actually inject isotopes and can find the blockages in your heart. And a newer modality, which is really great, is a CT scan. And so we are able to do those at Jersey City. We need to be able to do them all the time for everybody because it's very important, especially as we talk about risk factors, for those people that the risk factors are just starting to get high and they're really not interested in taking medicine for the rest of their life. You know, get a CT scan, find out whether or not you have some coronary calcium or cholesterol in your arteries, and then decide, maybe I should really think pretty seriously about this.
Well, I think we're going to have to go to break, but if it's okay, can you stay for another 2 minutes? Because I think there's a couple more questions we'd love to ask you.
Perfect.
We'll be right back.
Perfect.
I've got cancer.
We've got the highest level of cancer care,
the latest clinical trials,
researchers working to find a cure,
and nurse navigators to guide you every step of the way.
At New Jersey's only NCI-designated Comprehensive Cancer Center, your safety has always been our top priority.
I've got cancer, but I also have peace of mind.
Jersey City Medical Center and Rutgers Cancer Institute of New Jersey. Let's beat cancer together.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back to Hudson Health, everyone. My name is Dr. Angel Lazo. I'm with RWJ Barnabas Health, and I'm here with my colleague and co-host.
I'm Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a branch of RWJ Barnabas Health, and we're with the Chief of Cardiology at Jersey City, Dr. Kim Skelding.
Thanks for having me.
So, back on our second segment, and thank you for staying. Now, again, our Hoboken hub has cardiology, multi-specialty. You know, we discuss risk factors. Some of the risk factors for women, for example. What are some of the unique risk factors for women? Because women are very unique. They're typically the family bearers. They take care of the husbands, they take care of the children, but sometimes they don't take very well care of themselves. So what is your recommendation? What are the risk factors, for example, that a woman really should look for that's more pertinent to them as compared to the general population, say men, for example?
Well, I think, you know, the traditional risk factors are equally important in women. I think there are a couple of differences between men and women. One is our hormonal status. And so when women become premenopausal, perimenopausal, postmenopausal, everything changes. And many women get their primary care from OBGYN early in their life. And then as they need to really transition to see a family doctor or an internist. Because many women who have never had high blood pressure, never had high cholesterol, will then have it after menopause. Very important to remember. And often they'll say, I eat the same, I do the same, my weight's the same, I don't understand this. Yeah. And it really has to do with their hormone status. The second thing is thinking back to their history. And so, you know, as a cardiologist, most people don't ask about people's pregnancy status, you know, but women who have had any complications with their pregnancies, whether it be high blood pressure or high blood sugars, fetal demise, all of those pieces, they can give women a risk of about 10 times of heart disease that their male counterparts would. So really important to think, what happened 10 years ago? What happened 15 years ago? Because it changes how we treat them through the rest of their life.
Wow, I never thought of that pregnancy and hormonal risk factors, and then add the sleep. But what of genetics? How does that affect women? Is it the same men and women? It's different.
Yeah, so there are certainly people who have a genetic risk for having a heart attack, even though everything else is fine. They're a pretty rare group. Most of us have risk factors for other risk factors. In other words, we have a family history of high cholesterol, high blood pressure, obesity, diabetes, all those other pieces. The good news is even though we genetically might be more at risk for high blood pressure, cholesterol, we can do something about it. So we call those modifiable risk factors. And so that's really more of our genetic risk. Everyone has someone in their family who's had a heart attack. And I often ask, well, were they diabetic? Did they smoke? Because those things make a huge difference.
Very, very interesting. Now, as far as sleep is concerned, because, sleep is somewhat associated with heart disease.
Okay.
Yes.
Go for
we'll
it.
Talk about sleep, absolutely. Because again, obesity is such a problem, and obesity is related obviously to hypertension and related to heart disease as well. So what do you tell your patients as far as sleep?
So I ask every single one of my patients, every female patient I ask them about their pregnancies, and every female and male patient I ask about their sleep habits, because I want to know. Most times people, even if they have sleep apnea, they don't really know they have a problem. So I ask them, does your wife, does your husband tell you snore? And if they do, let's talk more about that. Do you wake up restful? All of those pieces. Because many people can blissfully sleep for 6 to 8 hours and they snore like to high heavens and aren't even aware of that. Those things can really wreak havoc on your heart. I had a patient many years ago who was a young gentleman, obese, in his early 40s, who had been treated for bronchitis over and over and over again. Turns out he had heart failure.
Wow.
And all due to sleep apnea. So changed his sleep apnea, lost some weight, got on an exercise protocol, and really changed the trajectory of his entire life.
Now, where are we? Because, 2 decades ago, for example, someone presented to the emergency room with chest pain. If it was a man, everything would, everybody would stop, rush over, get the EKG. But if a woman came to the emergency room complaining of chest pain, the question would be geared more towards like, well, what did you do? What exercise? They wouldn't take it as seriously. And obviously, this is why we're very happy that we have a community here in Hudson County that's very involved, and an educated consumer is the best customer. What is the likelihood now, for example, that a woman would show up to an emergency room and not be taken seriously as far as heart disease? Where are we with that?
Right. So women still don't get treated at the same level. Not only do they not get as treated as quickly, but they often don't go home on the same medicines as their male counterparts. There was just a recent trial that was presented that showed they're not getting defibrillators at the same levels as their male partners. We're getting better. We're closing the gap, for sure, but not there yet.
But especially here in Hudson County.
Yes.
Because our women in Hudson County do watch Hudson Health.
Yes.
But thank you very much for being here. And any other further questions, Dr. Akunyili?
Yeah, this has been spectacular. Thank you very much for being here and for answering all our questions. Again, Dr. Kim Skelding, Chief of Cardiology at Jersey City. Pleasure having you.
Thank you.
And thank you for the talent that you bring to our community.
Thank you.
Absolutely.
Thank you very much. We'll be right back.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County because your heart doesn't beat just for you. So get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Everybody, and welcome back to Hudson Health. My name is Dr. Angel Lazo. I'm with RWJ Barnabas Health at Exchange Place, and I'm here with my co-host.
Welcome back. I'm Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a member of RWJ Barnabas Health. Very excited, really excited to have her as part of this community, obviously as our Chief of Cardiology, but a lot of innovative things. I was just completely taken aback by how she describes not just heart disease prevention, but the differences between men and women, which you learn something new every day, even after all these years of practicing.
Absolutely. And especially with the prevalence of the disease of heart disease, you know, it really spares nobody. And unfortunately, a lot of the times, by the time you end up having a symptom, you know, you're actually in trouble. And again, I do primary care as well as just family practice. And again, this is typically our focus is preventive medicine. And again, she discussed some of the risk factors, you know, even sleep that has a lot to do with heart disease and so on and so forth. It's just very, very exciting to have such talent that's actually attracted here at the medical center.
I agree, and part of our teaching enterprise as we train the next generation of doctors to have somebody like her. I like how she describes not just the risk factors for heart disease, how to prevent it, but also the innovations we have in terms of treatment, but also clinical trials that, quite frankly, previously did not include women, people of color, and how we're bringing that to the medical center.
Yeah, and again, I'm going to say it again, the academic practices that, you know, RWJ Barnabas Health is the leading in the state of New Jersey with academic practices. And this is a perfect example with, for example, the leading cause of death in the United States, which is heart disease. And with our program that we have at Jersey City Medical Center, we have the whole gamut, including satellite offices in Hoboken and all throughout the state. So it's very exciting to actually have, you know, the talent that we're able to attract. We had Dr. Benz here, I think it was just a little bit ago.
We did.
And again, Dr. Benz is one of our cardiologists in this community. But the ability to attract someone like Dr. Skelding is just phenomenal. RWJ Barnabas Health is just...
I agree. And you know, something we've talked about as a theme throughout this show has been access for our community.
Yeah.
And part of access is recognizing risk factors, having places to go, and quite frankly, being treated the same. And we noticed she talked about men and women not quite getting the same level of care. That's something we're very well aware of and excited to welcome our community, whether it's women, people of color, to come seek heart health when they need it. Over 40, she said you should go once a year to a cardiologist. Okay.
Absolutely.
And sleep more than 6 hours.
And sleep more than 6 hours.
I don't know. I'm still hung up on that all these years because it's important. I think it's easy to sort of get caught up in day-to-day life and forget that. How important it is for health.
And not just the advances, especially in cardiology, that are offered now in Hudson County, especially through the programs that Dr. Skelding is establishing for our community. But again, the clinical trials, it's the academic medicine, so that we're offering just beyond the standard of care. Again, we put the emphasis on the standard of care and also on the preventive medicine piece, especially in cardiology. But to be able to offer our patients the leading technology and to be able to be enrolled in trials and so on and so forth, it's a win-win for the institution as well as for our community. So we're going to be circling out of here in just about 2 minutes. So
Absolutely.
I just wanted to thank you, and I'm so excited we had Dr. Skelding on, and Dr. Benz.
I am too. Thank you.
All right, thank you all for joining us, and we'll see you back next time here at Hudson Health.